I found myself a caregiver for my loved one, Is Rappaport, when he was diagnosed with pancreatic cancer. I had had no experience with cancer or dying people or death when this happened. The doctor told us that we had about a year at best. I started to care for him by myself because there was really no one else. This is my story. I started caring for Is, driving him to the doctor appointments, sitting with him while he had chemotherapy, and starting to do a lot of the little things that he could no longer do for himself. As time went by, I began to get more and more tired, both physically and mentally. So I began to look around, check out what was available in the surrounding area for support. And that's when I discovered the Hospice of the Golden Isles in Brunswick, Georgia, where I went to talk with one of their chaplains. We toured the hospice, which included their inpatient facility, residential unit, and bereavement center. As we were going through, I really began to see that it looked like a wonderful place and really just what we needed as I met some of the other people there, and it was clear everybody had a wonderful attitude.
Family and friends often come here to find out about hospice. Many people don't realize that all hospices are not alike. Hospice of the Golden Isles in Brunswick, Georgia is a non-profit hospice. It has been working in Glynn County and the surrounding counties for 30 years.
Everyone deserves the right to die with dignity. When medical treatment can no longer bring a cure, then comfort and quality of life become priorities. Personal wishes become more important than waiting rooms, tests, or spending time at the hospital. This is where the comfort care of hospice begins. Hospice care neither rushes nor resists the natural dying process.
No one really knows how long a person has to live at the end of their life. It would be like predicting when a baby would be born naturally. Sometimes people live for short periods of time, and sometimes they live on and have many opportunities for quality of life and time with family and friends. In hospice, we focus on helping families and patients understand the progression of their disease, what kinds of signs and symptoms to look for, and how we can relieve the suffering of a person, both spiritually and emotionally, as well as physically. When a person comes on hospice, they may live for a year or more, but they may only live days or even months. When the patient and the doctor decide that medical treatment can no longer bring a cure, or if the patient decides to stop aggressive treatment, hospice is often the best choice for care. The focus of hospice care is on end-of-life, compassionate care and comfort, educating patients and their loved ones about their care choices, planning for your family's needs, and also for the grief needs of the family.
Life can take on a new meaning when you understand that there is no guarantee to the amount of time that you have left. Take time to visit with friends, shop, attend church or synagogue, or continue with your social life. Keep the remaining time as normal as possible. Some patients in hospice are still able to travel. One family went to Disney World for a family reunion. Patients may need time to be alone, speak to a friend or a clergyman, or make important decisions that will be easier for their family as they are dying.
After 14 months, our oncologist told us that there was really nothing else he could do, and then he referred us to the hospice. A nurse came with a social worker, they examined him, and they did an assessment of him and of me. He then signed his own admission papers and became a home hospice patient. They sent a nurse once or twice a week to see him. They also later on sent oxygen. They had a tank for upstairs in the house and another tank for downstairs in the house. And there was a 24-hour nurse on duty at their facility for reassessment. A chaplain came with a social worker later on, and they began to talk with us because we had some difficult decisions to make. It became clear that I could no longer take care of his physical needs at home.
Most hospice care is provided in the patient's residence. When there is a need to stabilize medications or address end-of-life symptoms for a short period, a patient can be brought to our inpatient unit. Medical staff attends to his or her physical symptoms with medications and comfort care in the inpatient facility. A big difference in hospice care is that the patient makes the decisions about his or her care. The patient and family work with doctors, nurses, social workers, or chaplains to make care decisions. The patient's wishes are honored.
I'm the one the family calls on. I've had to take care of so many people. Now, I'm not sure I won't remember some basic things, but I'm going to look over that handbook and make myself a checklist.
I used to let the doctor make all the decisions for us. This is confusing. I have no familiarity with this. I don't even know the questions to ask. Well, and I don't know how to ask for the help I need to make good decisions.
All of our staff, the doctors, nurses, certified nursing assistants, chaplains, and social workers work together to provide a peaceful and comfortable environment for the patient and family. We work to create and provide a respectful and calm environment for the patient. The feeling in the room remains unspoken, but means that whoever comes in will be considerate, and whatever goes on there will be peaceful and quiet. We listen to the needs of the patient and family.
I moved here to this area about, a few years ago because I had to look after my mother. She had Alzheimer's disease. Well, she was in the early stages then, but recently she's been getting worse, and I really can't look after her the way I used to, all by myself. So I thought I would come here to hospice and find out what our hospice benefits were. And so that's why I'm here today.
I just worry because my husband is not eating. I wonder if he could have some food. He doesn't seem to want anything. Would it be all right to give him a little food or a sip of water? It seems strange because we were accustomed to eating dinner together.
Usually when a person enters the end of their life, they stop wanting food or drink. Usually they may be having difficulty swallowing. Sometimes they can aspirate, which is what we call inhaling liquids into the lungs, which can cause pneumonia.
I was it. My brother didn't have anyone to take care of him, and so he turned to me. But I can barely take care of myself. So I arranged to have him put in a nursing home with hospice care, and it seems like it's working.
We never discussed wills, do not resuscitate orders, advance directives, or funeral arrangements. I think I was afraid that if we talked about it, she might die sooner. And we never had those conversations. We kept putting them off. Now that she's gone, I'm having to decide what she might have wanted done. It's very difficult.
My husband is a veteran, but we never ever discussed what kind of benefits might be available for my children and myself after he's gone. I've always gone to the base for our medical needs and supplies, and now I don't know where or who to turn for help. I just feel lost. The only thing I do know is that he wants to be buried in a military cemetery, and I do not know how to make that happen.
In most general cases, there's information available on the internet that will help you understand what important papers you have that you need to have and where you can find that information. You can also find information at your local libraries and at the local bookstores.